Hi, my name's Nicole Kane, and for our EXS 486 case study, I chose to present to you cerebral palsy. I chose CP because I have a cousin who is currently suffering with CP. She's 40 years old. She lives a happy and slightly active lifestyle, but for the most part, it is sedentary. She did not attend regular physical therapy as she should have when she was diagnosed. This is probably because back when she was diagnosed, physical therapy wasn't as prevalent as it is today, and I don't feel as though her family was as supportive as they should have been. And they probably just didn't think that PT was going to make all the difference, when in reality now it probably would have. With age, her CP is becoming increasingly worse in relation to her mobility. And although it's not debilitating, it does increasingly get worse with age, just due to the normal human aging process. What is CP? CP is caused by a non-progressive brain lesion developing soon after or during birth. It blocks and inhibits normal brain development. This lesion would affect coordination, muscle tone, reflexes, posture, and cognitive function along with movement. There are two major types of CP. There is spastic CP, which is an increased muscle tone in the upper body, and hypertonicity is typically found in the head, neck, trunk, and chest area. The other type is athoid CP. This would include involuntary and uncontrollable movements in the extremities. This would probably look like flailing, twitching, things like that. Things that make CP a little worse is stress, cold temperature, fatigue, and it can pretty much be improved by warm weather, less stressful situations, and a lot of stretching and activity. It's very prevalent, as shown in this graph, in the African American community, although over years it has decreased in the fact that not as many children are being born with CP. It has decreased to 1 to 5 births per live birth. Also, spastic CP occurs in 70% of the people who are diagnosed. Risk factors include congenital malformations, fetal growth restrictions, multiple gestations, birth asphyxia, and preterm delivery. Multiple gestations would just mean that it's more common among twins just due to the lack of space within the womb. And like I mentioned in my cousin's case, birth asphyxia is a gigantic risk factor. That would be when the child is deprived of oxygen while in the birth canal. Intrauterine exposure to infection can also be an extremely high risk factor, just because this infection could potentially damage or stop the brain development process while or during pregnancy. Signs and symptoms of CP in children would be that a child is extremely stiff, or while they're being cradled, their back is overextended and it almost seems as though they're pushing away from the person that's holding them. This would be due to the increased muscle tone and muscle tightness that someone with cerebral palsy experiences. In children older than 6 months, if the child doesn't roll over in either direction properly, or they have trouble coordinating their hands and moving something over the midline of their body, this would mean that the lesion causing CP has not allowed the child to develop bilaterally and integrate that way. If a child is older than 10 months and scoots on their bottom but doesn't crawl, or crawls in a lopsided manner, this would be more of a reason to start looking into whether or not your child may have a neuromuscular disorder. These two graphs here simply describe signs and symptoms of CP in children in a more visual sense. A lot of these symptoms do carry over into adulthood, but if actions are taken immediately and treated and the child is put into the right corrective facilities and services, these symptoms can be almost entirely lessened. The seizures and the intellectual and psychiatric conditions, they can be helped and improved if they are treated immediately. Also, urinary incontinence can tend to develop over time, not so much during childhood. A diagnosis isn't something that happens right away for cerebral palsy. It's something that needs to be monitored as the child develops. There isn't, one thing you can look at and say, okay, this person definitely has CP. It's something that you need to take into consideration that my child does this but doesn't do this. It'll be monitored by the parents, by doctors involved, and then it will later be confirmed with imaging testing, such as MRIs, CT scans, cranial ultrasounds, and EEGs. Someone is usually diagnosed within their first 4 months of life, and if not by then, definitely by their first birthday. The cranial ultrasound is the most common way of determining if there is a brain lesion. This is because it gives very quick results and it's super easy and non-invasive. Unfortunately, there is no specific cure for cerebral palsy, but there are so many ways to improve somebody's quality of life who does have it. This will be something that the person will have to deal with for the rest of their life, so it's better to get started on that path when you're young and you can, completely adapt to that way of life rather than starting late. There are so many complications and side effects with this disorder that a person will most likely be subject to various testing and will be connected with these doctors for the duration of their life to make sure that their possible vision impairments are monitored, their hearing, their speech, their intellectual possible disorders, and of course their motor disorders. In my eyes, the most beneficial form of treatment would be physical therapy, occupational therapy, and speech. Another form of treatment would be a medication treatment. Botox could be used to relieve some muscle stiffness immediately on site. This would be an injection. But you could also use muscle relaxers such as Valium, Dantrum, and Glabofin. Muscle relaxers are really important because over time, when those muscles are so stretched and so tense constantly, it can be very, very painful to perform daily activities. Also, orthotics have proven to be very beneficial in someone with CP. Effects of CP on exercise. It's that it completely limits someone's range of motion, and limiting a range of motion puts a cap on what someone can and cannot do basically in all aspects of life. With flexibility training and physical therapy, this can definitely be improved, and then exercise can then be added, and more intense variations of exercise can be introduced to somebody. Also, if they do have spastic movements, this could pose a threat of safety within the gym. If, say, they're going to go start lifting weights, they may not be prepared to do something like that. CP, fortunately, doesn't usually have an effect on the heart. So if they can do some cardiovascular training, it would probably be really beneficial. Also, it would be important to make sure the person has adaptive and appropriate inclusive equipment that may need to be used if, say, they have some problem grasping things or need a little extra security while working out. The case study I'm choosing to discuss is a patient who's 15 years old. She had been diagnosed with CP at birth. She participates in regular day-to-day activities but isn't considered physically active. Since puberty, her symptoms of CP have gotten increasingly worse, and her cognitive function has slowed, her emotions seem to be dipping into a slightly depressive state, and her physical symptoms have gotten worse as well. The goals of this treatment plan would be to first improve her mental health, because before you want to get physically right on the outside, you need to be physically okay on the inside. It would be very hard to deal with CP as a young girl, just wanting to do things your friends are doing and maybe not being able to. So we want to get her happy and healthy on the inside before we start really doing some serious life-changing activities on the outside. Her hobbies include that she works at a local library reading to kids 3 days a week, so this improves her reading skills, her vision skills because she's looking close up, and she's also happy being there. She enjoys painting, listening to music, and spending time on the beach. The treatment plan, like I said, will include physical therapy. Flexibility training is so crucial because improving flexibility improves range of motion. This improves your ability to do daily tasks. This increases the possibility of doing more exercise. PT will always start with heat to loosen up those tight muscles and get blood flowing and making sure nothing's being strained while working out. We want to stretch till we feel slight tension. We want to do proper gait training so that she walks correctly and can maintain those good features she has while she is young. We want to do reflex training, possibly catching and throwing a med ball. Muscle stimulation is also really important for someone with CP because sometimes they won't be able to lift weights, do resistance training. Muscle stim is a way to increase muscle tone without really doing the full range of motion. We also want to introduce weighted exercises with good posture. Weighted exercises doesn't always mean holding a weight. It could be wearing a weighted vest. It could be just body weight. But we want to make sure they're doing it with good posture because this is so crucial to everyday life. Some of these activities would be squatting, sitting to standing on a chair, side lunging, and holding a position on your hands and knees so that it integrates all muscles of your body, and maintaining that position is just a good exercise in general. PT will always end with ice to ensure that things aren't sore the next day. We also want to introduce assisted exercise with a training coach, possibly starting on some arm pedaling since her upper body is really in good shape. And then to get her lower body involved, we would probably do some resistance band training, hip abductions, adductions. We would also possibly do some hamstring exercises, just to get those muscles moving and blood flowing and prevent atrophy. The treatment plan continued. Like I mentioned, we want to get her mentally healthy and happy, probably most importantly. We want to get her involved in talk therapy, seeing a therapist once a week. We don't want to introduce any type of antidepressant medication. We want to see if we can get this figured out before we introduce any more medication to her system. I think a good idea would possibly to introduce art therapy so we can combine her love for painting along with fixing some of these depressive episodes she's been experiencing. It's important to modify some exercises for people with CP just because they physically can't always go through the range of motion. Individuals who have CP tend to have a higher energy expenditure because their muscles are constantly being tightened and constantly being stretched and have a lot of spastic, uncontrollable movements that unfortunately that's where all their energy is going. So it would be really hard to do bouts of, quick arm pedaling or cycling on a machine. Cardiovascular training should almost always occur in short bouts of moderate intensity at about 40 to 50% of their VO2 max. These are my works cited. I hope you enjoyed listening. In conclusion, I'd just like to say that cerebral palsy is a completely combatable disorder. This is something that can be improved by the simplest of tasks. It would just be stretching, moving your body, getting active, standing up. Don't let your body make you feel like you need to sit and just sulk almost. But it also is important at the same time to listen to your body and make sure you're taking care of it. So thank you so much for listening, and I hope you learned a little bit more about CP today. Thank you.